Hi, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is retinal detachment. We'll be talking everything about retinal detachment. Retinal detachment is the condition when your retina is separate from the back side of tissue. So let's talk about the retina first. In my previous videos like keratoconus, I uploaded video on keratoconus, that is bulging out, and I have uploaded video on retinitis pigmentosa, that is genetical problem, and in which you have vision problem. So this is the again eye condition, emergency eye condition in which you can have partial vision loss or you can have severe vision loss. So if your retina is detached partially, then you have partial vision loss, and if it is detached completely, in that case you have complete sudden vision loss. So in that case this can be an emergency condition. So, let's talk about the. I was talking about the retina. See, retina is a very important part of the eye, and retina parts of the eye, and altogether the image is formed, on the backside of your eye, that is retina, and through the optic nerve, retina sends signal to your brain for the final and the proper detailed image. So that's how very important for you. So in the Regmator genus retinal detachment, yes, there is a tear, in tear on your retina, there is a tear and there can be a hole, and through the hole your fluid from your front part of the eye can go backside and they can get accumulated. That reason your retina can separate and can detach from the back side of your tissue. So this way you can have Regmator genus retinal detachment. Traction. See, traction is usually found in the cases of diabetes mellitus, and they are called like diabetic retinopathy. Traction is usually due to your scar tissue. Scar tissue pulls your retina, and that's why your retina is detached, separates. So, the blood vessels are, they are damaged, they are distracted. So that's your retina detached. The number third is the exudative. See, in this there is a fluid accumulation, but it is not due to retinal tear. It is due to excess accumulation of the fluid. This can be due to an injury, can be any inflammation, any eye injury, and after surgery. So fluid retinal detachment, different types of retina. Now the risk factors means who are prone to have this condition. See, there is a family history. See, anyone family you can have this problem, and your personal history, if you had earlier you can have it again, means the condition is recurrent one, you can have it again and again if it is not treated properly. There are certain injuries, you can have certain eye injuries, and there are some surgeries. If you had your cataract surgery, so you can have this after that as a complication. It's not the condition. And if you are severe nearsightedness in aging, again blamed, like if you are 50, you can have this problem. Aging, family history, your past history, eye injuries, certain these act as retinal detachment. Moving on, the sign or symptoms of retinal detachment. I discussed earlier that if your retina is detached, partially, then you have only partial vision loss, and if it is detached, separates completely, then you have complete vision loss, or this can be an emergency condition. See, where you can have even blindness. So yes, there can be partial vision loss, there can be complete vision loss, can be like flutters in front of your eye, because yes, there is a fluid accumulation in your retina and there are dark spots, and you can have flutters in your vision, you can have flashes in your vision, and things you can develop with time. So these. Now moving on, you see your doctor and they give you some eye drops to see your pupil dilation, how your pupil responds to that particular eye drop. And retinal studies can be done, retina complete, they can take some photographs of your retina and they can evaluation purpose. In allopathic part of treatment, if your condition is severe, and if it is recurring, so would be better option for you. Yes, there are some surgeries, thermal surgeries and cryosurgeries you can go. How you can prevent this condition? If you had it earlier, you can prevent this by you can take some steps, like if you are diabetic, you just have fair control on your blood sugar. If you are hypertensive, means you're having high blood pressure, just control that, means your BP and sugar should be fairly controlled. And if you have any sort of eye pressure, just treat that. The bottom line is that treat your underlying cause, get worse with the time and you don't have any problem. Moving on, the most effective or top effective homeopathy medicine. Yes, we are having so many medicines and they works wonder. You can use according to your case, and if you're watching on YouTube, you can find medicines link on the description box. I'm having Arnica montana. You must have heard about Arnica montana, that it is a very good medicine for all sort of injuries. Means you're having injury, but that is internal, means there is no laceration, there is no cutting, only internal injury. So if you had any blow, any severe eye injury, in that case you can use this is in the liquid form with the help of dropper. This is oral form of the medicine, so you can use this. You have retinal detachment due to severe injury, eye injury, so in that case you can use Arnica montana. Like you can start with the 30 or 200 potency. This is Boiron homeopathy medicine. You can use whatever company available at your place. So like 2 or 3 drops twice or thrice before meal for regular use. This way you can use this medicine. The next Aurum metallicum. See, Aurum metallicum is the in all damage, all destruction cases. Means this medicine belongs to syphilitic miasm, and syphilitic miasm in homeopathy is the miasm, means there is a last condition, there is a last stage of any disease. Means you are having distraction. So if you have any blood vessel related issues, if you have diabetic retinopathy, this medicine works wonder. Retinopathy means you are having retinal detachment in the traction cases, like due to traction your blood vessels are damaged. So in that case you can use Aurum metallicum. Again, oral form of the medicine, 2 to 3 drops twice or thrice before meal regularly, again to the improvement in your case. Gelsemium, again very good medicine in all eye problem. Gelsemium works wonder. Like Gelsemium is a very good muscular tonic, you can say. Gelsemium, like if you're having any fatigue, any muscular weakness, so this gives you strength. So if you're having any eye ptosis, you're having drooping of eyelid, in all these cases Gelsemium works wonder. Again, you are having high eye pressure, means glaucoma, in that case Gelsemium works very good. So you can use Gelsemium in 30 or 200 potency. Again, oral form of the medicine, twice or thrice, again for minimum like 2, 3, 4 weeks. So these are the medicine. There are some other medicines, like you can use naphthalinum, very good medicine. You can use Jaburandi, again very good medicine when you have opacity of your lens, means you have vision related problem, you are having cataract along with your retinal detachment. In that case you can use Jaburandi. And yes, there is again very good medicine when you have constant staring, you have asthenopia, you have astigmatism. So in that case you can use Ruta. Medicine when you have dim vision problem, diplopia, irregular vision. So these are the medicine, all are oral form of the medicine, and you can have eye drops. Like I have given all the medicines link on the description box, and there are some there are some eye drops in homeopathy, like Cineria for the vision problem, Euphrasia for the eye infection, and R78 for the all eye related problem. So hopefully this video can help you. If you find this video knowledgeable, informative, please like and share. If you're new on channel, press the bell icon to get notified, and don't forget to subscribe my channel. Thank you for watching. Thank you for support. Thank you so much.